If you just focus on strengthening and increasing the load you can hold, the amount of weight you can lift, those muscles are just going to get tight and remain that way.
You're listening to the Ethos Athletes Podcast, where we believe that your health is the number one resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matthew Hernandez, and you're listening to the Ethos Athletes Podcast, where we give you tips and tricks on how to stay active in your life. And we're going to be continuing our series talking about injuries that occur with rock climbing. And for this particular series, I'm bringing back Dr. Michelle Snow, who is the owner of Ascend Chiropractic and a rock climber herself. So Dr. Snow, welcome back.
Thank you. Thanks for having me.
So we've had a few episodes now where we've talked about common injuries that rock climbers experience, and then we broke those injuries down into episodes that are specific to a given region. So we talked about shoulders, thoracic spine, low back, hip, different things like that. Now, the beautiful thing about the tips that Dr. Snow is providing us is that even though we're talking about rock climbing, these injuries can actually occur to people in everyday life. And the tips that she's giving on how to deal with these can actually help you even if you're not a rock climber. Today, we're going to be discussing injuries that can occur to the hands. And I would imagine, and you can correct me if I'm wrong, Dr. Snow, I would imagine that this is probably one of the more important things for rock climbers, right?
Yeah, exactly.
So tell me a little bit. I would imagine that when we're looking at the hands itself and when you're dealing with rock climbers specifically, you get a lot of questions regarding injuries to the fingers, stuff like that. Can you tell us a little bit about that?
Yeah, so fingers and hands are, I would say, the primary concern that I get questions about with climbers because that's their day-to-day. That's what they need to climb. Climbing overall is a full-body sport. Mm-hmm. But your hands are really important to that. So I have climbers that are particularly concerned about their fingers and all the tendons that are in there. Getting injuries to those can be pretty detrimental to their climbing activity. So that's always a major concern for them.
Okay. Let's go into this a little bit more specifically. So when we're looking at tendons and the hands, there's different types of pulley systems that actually run through the hand and the tendon itself. Can you explain a little bit more about what that is and what that looks like?
Yeah. So in particular, the tendons that climbers are usually most concerned about are the flexor tendons. So that's on the palm side of your hand, and there's two sets of tendons that do flexion of the fingers and the wrist. There's a long flexor tendon that connects all the way to the tips of your fingers, and then there's a shorter pulley tendon set that connects kind of to the middle of your fingers. So those pulley tendons are really important because they hold those longer tendons in place. So when those get injured, it can be detrimental just to the structure of the hand, but also the function of that flexion activity. Because if that pulley tendon is injured and isn't able to properly hold that long tendon in place, it can kind of bend the finger and create like a bowstring effect of the finger. Okay. So that usually has to be fixed with surgery, which is why it's a big concern for people to injure in general, but especially with climbing because it means a lot of time out from the sport to recover from that.
Yeah, absolutely. And I would imagine if you get that bowstring effect, you're going to lose the grip strength that you have and all that, correct? Which obviously you don't want if you're climbing.
Yeah, exactly. And it can take a while for that recovery to occur. So there's minor tears that can happen in those pulley tendons, which you want to be careful of and recover well from so that you prevent future injury and more major injuries to happen to those pulley tendons. But if they are severely torn in more than like 50% of that tendon is torn, typically that has to be surgically repaired. And so you can be out for months recovering from that post-surgery. And, any pulley tendon injury, you have to basically cut your strength and your climbing ability down a ton and climb at very low levels compared to what you're used to in order to gradually build that strength back up as you're recovering from that pulley tendon injury.
Okay. And the injuries you mentioned are going to be tears to the tendon themselves, correct?
Correct.
Okay.
Yeah.
What about in instances like trigger finger or anything like that? Can you speak to what that is and and what that affects?
Trigger finger is more, I would say in my experience, like it restricts more like the movement and the motion of the finger. So you might still have generally the same amount of strength, I would say, in most cases, but the range of motion is a lot more restricted.
Okay. And that's just, it's going to be swelling and scarring of the pulley, or where the pulley attaches, essentially, correct?
Yeah.
Okay.
Yeah. So you might not be able to grip as far. So again, that range of motion, you might not get that full grip, but the strength of that area is typically about the same.
Okay.
Unless it's causing you pain, your body always wants to avoid things of pain. So it might not want to contract because it has that experience of pain when it does, but the actual structure of the tendon is typically pretty much intact at that point.
Okay. So going back to the tendon injury that we were talking about before, where we get tears in the tendons, how do those tears occur? Is it just, wearing down of the body from the activity that people are doing?
It can be a gradual process where those pulley tendons get aggravated from just climbing hard and using them a lot. So it starts as kind of that overuse injury. Those tendons and all the ligaments around it get just aggravated and inflamed. But a lot of times, especially if it's a severe tear of those pulley tendons, it usually is from like one event that causes it to a lot of climbers, you'll hear them say, I popped a pulley. So it's like, because there's a lot of tension and strength in those structures for climbers, if it is a severe tear and it basically almost completely tears, you will hear kind of like a popping sound, just because of the tension through those tissues. And so that's why you'll hear them say like, oh man, I popped a pulley the other day. Okay. So that
doesn't sound like fun.
Yeah, it's not a fun thing to go through, and it's a weird experience to have.
I would imagine, fortunately, that as severe as this can be and as detrimental as it can be, that it can be prevented, right?
Oh, yeah, for sure.
Can you talk to us a little bit about what that looks like?
Yeah. The prevention of it is just related to, like, gradual exercises, basically. Okay. It's listening to your body is the most important thing. And so if you start to feel a lot of tension or just like aggravation in your hands and in your fingers, being mindful of that is super important. So maybe you need to take an extra rest day or two in your climbing routine for a couple weeks, or just climb at a lower grade level than you typically would. Okay. Some things that I like to encourage climbers especially to do to just gradually build up that strength of those structures is things like hangboards. Hangboards are cool tools to use. Do you know what a hangboard is?
I have seen those before, yeah. Cool. Absolutely. So explain it to our listeners.
Yeah, so it's basically this board structure that's typically hung high on the wall, and you can it tests and strengthens different types of grip strength. Mm-hmm. So in climbing, there's different names for types of holds and grips that you can have. And so it puts tension on different structures and parts of your hands and your fingers. So you can gradually train on hangboards to increase those different types of grips. So typically there's different styles of them, but there's some sort of holds that have like little pockets you can put like the tips of your fingers in. Mm-hmm. That's going to put a lot of tensile load throughout the whole finger and kind of primarily on those tips. So it will strengthen those little structures at the end of your fingers. Then there's other parts of the hangboards that typically have bigger, more like rounded structures you can hold on to. So that's going to strengthen more like your whole hand and your palm. So you're creating that like gripping motion throughout the whole hand rather than just squeezing and using the hand, the finger flexors.
Okay. I would imagine doing the hangboard and all that. I mean, the whole goal is not only to strengthen those areas, but I would imagine it strengthens your grip quite a bit as well, right?
Yep.
I mean, you have one of the tougher grips for people that I know. So I think that says a lot from you using the hangboard and what you do already. I would imagine there's a combination of like stretching, strengthening aspect to this as well. Is that correct?
Yeah, exactly. Okay. With any part of your body that you're trying to strengthen, you need to have that balance between stretching and strengthening, because if you just focus on strengthening and increasing the load you can hold, the amount of weight you can lift, those muscles are just going to get tight and remain that way instead of gaining the strength, but also elongating those muscles back out with the stretching. So that's really important, I would say, especially with the smaller structures in the body and in particular into the hands, because they're small structures, so they're not made to hold a ton of weight, and so they can get aggravated pretty quickly if you don't gradually train as well as stretching them out.
Okay.
So some things that I like to teach and encourage is to do both warm-ups and cool-downs, especially before and after your climbing activity or whatever workout you're doing. And stretching out those flexor tendons and muscles is super important. Okay. So there's some simple stretches that you can do, basically just holding your hand on the palm side and stretching back so you're extending that wrist, so the back of your hand is getting closer to your forearm. So you're stretching that palm side of the fingers and the palm and into the wrist. That will gradually, gently stretch out all of those flexor tendons that run from the hand, crossing over the wrist and up into the forearm. You can I like to add a little piece to that of doing a mixture of contracting those muscles and then relaxing them. So you're switching between the two, a few seconds of each while you're doing that stretch. It adds a little piece and makes that stretch a little more effective because you're activating that muscle using the the nervous system, and it allows those muscles to relax and just elongate more effectively.
Okay. For those individuals who didn't heed your advice and didn't, do injury prevention stuff, and they actually have injured themselves, or popped a pulley, as you said, which is a cool phrase. What are some of the things that you can do to address this issue?
So if it's a minor tear, that's something that rest is going to be super important, or just decrease amount of activity. And then with the climbers that I treat, there's some gentle muscle work that I can do. I do some like scraping is what I like to call it, because it's a long term that is a mouthful. But scraping for short, that just helps break up any like scar tissue along the way, because as you have that injury and it's recovering and rebuilding that strength and that structural form, it's going to try and build up in, I guess I'll say, like a bigger fashion, if that makes sense, because you had that injury there, your body senses that there was a lot of tension put on that structure. So it senses like, I need to build this stronger. Okay. That's the same concept, like as you're building up strength in your muscles and the tendons go along with that. Gradually over time, you're creating these little micro tears in those muscle fibers. And they when they get repaired by the body, it naturally grows stronger. So that's how you get stronger and are able to lift more weight, or your hands get stronger and your grip is better. So same thing in the recovery process from that injury, that area will get stronger, but sometimes it can form more like tough scar tissue in that process, where you want it to still have as much normal tissue and tendon-like structure as possible. So doing that scraping kind of helps break up that added scar tissue in the area. It brings a lot of blood flow to the area to help in that healing process. Yeah. And then those structures will be as normal as possible as you're recovering from that pulley injury.
Okay, awesome. And then how about, are there any type of like chiropractic adjustments that can make a difference with these treatments?
Yeah, for sure. I think preventatively especially, you want just the whole hand and wrist structure to be moving as optimally as possible.
Yeah.
So adjusting all those areas around there. All the wrist bones are tiny, but they can be adjusted, and a lot of times they get stuck, especially if there's a lot of tension or any inflammation and swelling in the area. And so adjusting the wrist down into the fingers, you can adjust the fingers as well and kind of tension them out to give those joints a little bit more space and length. It makes it more comfortable. And into the thumb as well. The thumb is a big important one that just allows you to have different types of grip, which is, what makes us as humans. We have the ability to do a lot more than any other creatures on the planet because of that. So.
Yeah, absolutely. Let's chat about the wrist for a second, because I've seen a handful of people that have come complaining of, have come into my office complaining of wrist pain, and when I evaluated it, you can actually feel, at least from on my end, and I'm most certain that you can feel this too, is where you feel like a wrist bone is out of place a bit, right? And so, and you, when I do my eval, then I can actually go and see like, oh yeah, your range of motion is limited right here, and you can feel where that occurs. Mm-hmm. Aside from the patient noticing a limited range of motion, is there anything else that they should, that tells them or gives them a signal of, oh, maybe my wrist needs to be popped? Because that's not one that, everyone thinks about the back.
Yeah.
Nobody thinks about, actually doing their wrist. And obviously people think about popping their fingers because that's like that's a common thing that people do.
Yeah.
But can you talk a little bit more about the wrist and what that can look like when it actually needs to be adjusted and different things like that?
Yeah, I would say some pain or discomfort in the area is a common thing that people will notice. I would say the range of motion is probably the primary thing because it's kind of an odd area and like a junction point between the forearm and the hand. So there's a lot of tiny structures that cross over and go through that area of the wrist. So because of that, there's a lot of things that could be causing that limited range of motion. But sometimes you can feel like if the bones in the wrist aren't moving well, there could be, again, that pain or discomfort, that limited range of motion. Sometimes there can be kind of like, I guess I'll say like a little bit of a crunchy sensation when you're trying to move the wrist around.
Yeah.
And it's just, the joint isn't moving and gliding as well as it should because it's just stuck because of all the structures around it. So sometimes it feels like kind of that crunchy or like grinding sensation as you're trying to move that wrist around.
Okay. How vital is like wrist strength when it comes to climbing? Is it, I would imagine it's not as important as grip, or is this something that people should pay attention to, is how stable their wrist is, or how stable their wrist is when they climb, stuff like that?
Yeah, definitely. I think it's really important all throughout the whole kind of upper body chain throughout the arm. Like you said, the grip strength is really important because you're trying to hold on to the holds and not slip off the wall, right? But when you're doing that, and depending on what type of wall and holds you're on while you're climbing, you're putting a lot of tension all throughout that whole upper body, out throughout the arm. So from the hands through the wrists, elbow and shoulder. Mm-hmm. So there's a lot of pulling and tension just due to your body weight and gravity throughout the climbing activity, especially if you're on any sort of like overhang type of wall. Okay. That plays a bigger factor into it. So it is important. Wrists are ones that, because again, it's a junction point and there's so many tiny structures in there, they can get aggravated relatively quickly and just gradually build up over time. That's where you'll see things like carpal tunnel and different issues going on in that area from our day-to-day tasks and positioning. And so it's important to have stability and strength through that area. And mostly that comes through strengthening those flexion and extension muscles in the hand, because they cross over that area. There's ligaments that hold the wrist and create that stability and structure, but having strong muscles of those that cross over that area is going to create a lot of strength and just stability kind of all throughout that region.
Awesome. Perfect. So going back to recap a little bit, biggest thing that we're worried about with the hands with rock climbers is popping a pulley or tearing a tendon in the fingers, right? Some ways to prevent that are using hang boards to gradually build up your tolerance and your strength, making sure we're doing proper stretches with that piece. And then if there is an injury, if it's I think you said greater than 50% tear, it's probably surgical. Mm-hmm. If it's less than that, then you can do some stuff like scraping to help bring blood flow, help collagen deposition to help rebuild that tendon, as well as adjustments, different things like that. Is there anything else that we missed in this talk on the hands?
I'll give you one other quick kind of injury prevention exercise you can do. It's simple. You can do it anywhere, sitting at work or in a classroom. But if you take a rubber band and put it just gently around your fingers, all of your fingers together, and then you can splay your fingers out. And that little bit of resistance that the rubber band puts on those fingers will help just gradually increase the strength of all those tendons and tiny muscles and structures in the hand. So you can do that, all the fingers together. You can even do it kind of opening and closing 2 fingers at a time. You just have to wrap the rubber band slightly tighter so you have that bit of resistance. But that's something that a lot of professional climbers do too, just to keep their strength and prevent those injuries, because it's a lot more important, because that's they're living their way of life when they're climbing at that level. Yeah, awesome. Well, Dr. Snow, thank you so much for educating us on the hands and being part of this episode. Thank you. It was a pleasure.
And we'll have her back on our next episode, which is the last episode of the series, where we're going to be talking about the ankle and then a small muscle behind your knee called the popliteus muscle. So thanks again for listening, and we'll catch you on the next episode.